Hello everyone, and welcome to this audio podcast. As part of the probe series. This audio podcast as part of the Storm and Smash Up. This audio podcast as part of the specials, and this audio podcast as part of the concert and shout out, and this audio podcast as part of a Storm and Bostics production. In this audio podcast, I'm sort of going into closing off on this audio podcast series. I look at the conclusion. In and as part of works that have been developed by a science student in Bohtha, and part of being part of an academic institution in the United Kingdom. So Bohtha highlights in as part of the conclusion, and looking at cellular localization of tumor kinase in amongst breast cancers, but also looking at protein tyrosine kinase 6 or BRK and PTK6 in amongst tumor developments in amongst and across different different cancers. So in conclusion, then, there are two types of tumors, again, called one being referred to as benign, one being referred to as malignant. Breast tumor kinase, or BRK, was first identified in a breast cancer biopsy, and BRK is expressed in many cancers like prostate, pancreas, in many cancers such as prostate, pancreas, breast, and colon, and in some places it expresses in the normal cells as well. And mainly, just to additionally iterate here, is because the epithelial cells, the sort of epithelial cells, as part of normal or default sort of pathophysiology, if you will, is where the epithelial cells between the particular organs have some similarities. Hence why for example, hence why obviously BRK being specific or particular to breast cancer tumors, but where PTK6 or protein kinase 6 is and will be applicable to other epithelial cells more generally. So the study, so the investigation of cellular localization or location of BRK is important, because BRK activity is depending because BRK BRK activities or its elicited nature depends upon the substrates which limit limit within this in amongst cellular environ. The cellular location of BRK seems to be in amongst the nuclei, and in some occasion it is in some environs. Additionally, it is within. It can be located in the cytoplasm. In the cytoplasm, or in the nuclei, BRK interact with many proteins like SAM68, STAT3, and ERB2 to improve cancer cell or preclude cancer cell proliferation, and allow better patient prognoses. When it comes to the location inside of cells, inside of particular cells such as prostate cells, normally BRK is expressed during a cancer, and it transmits can transmit or traverse into to the cytoplasm. But BRK is not expressed in normal in normal breast cells per se, and but is seen in cancer cell plasma membranes. Colon cells express BRK in the later stage of cell cycle, and mainly in the cytoplasm. Furthermore, a number of pharmacotherapies for these cancers are based on targeting BRK. In general, chemotherapy and radiotherapy is perhaps the most common is perhaps one of the most common pharmacotherapies and sort of treatments for targeting in around the growing of cancer cells. Estrogen receptor and the phosphatidylsylsinetyl 3 kinase, or PI3K, and the mammalian target of rapamycin, which is an important sort of immunosuppressant agent, and the androgen receptor have can be a sort of treatments in around precluding or preventing preventing in around some of the growth of the particular cancer cells, and linked to BRK, linked to both BRK and PTK6. Additionally, just to iterate that the epidermal growth factor receptor is also and can be also important for the targeting of for and where particular pharmacotherapeutics are and can be used for again different in around forms or varying forms of cancer, or relating cancers to that where BRK and PTK6 are important or can be important. So that draws this audio podcast to a close. This audio podcast is part of the Probe series. This audio podcast is part of the Ztorm and Smash Up and the specials. This audio podcast as part of the Consular and Shout Out, and this audio podcast as part of a Ztorm Robotics production.